Robyn Lynn Sztyndor, ESQ, explains how healthcare providers can navigate regulatory challenges with confidence. Healthcare organizations operate in one of the most highly regulated sectors of the economy. Physicians, medical practices, hospitals, and specialty providers face a complex web of federal and state healthcare regulations that continue to evolve alongside changes in reimbursement models, enforcement priorities, and patient care standards. At the same time, government agencies, private payors, and regulatory bodies have expanded oversight efforts, increasing scrutiny of documentation, billing practices, and compliance programs. Even providers committed to delivering quality patient care can find themselves confronting audits, reimbursement disputes, or investigations stemming from administrative errors or differing interpretations of complex regulatory requirements. In this environment, legal guidance has become an important component of organizational risk management rather than simply a resource during litigation. Attorney Robyn Lynn Sztyndor is an experienced healthcare defense attorney, has spent more than 15 years representing physicians and healthcare providers navigating these increasingly sophisticated legal and regulatory challenges. Her work reflects a practical philosophy that emphasizes preparation, compliance, and strategic planning as effective tools for reducing legal exposure while allowing healthcare professionals to remain focused on patient care. Why regulatory pressure continues to increase. The modern healthcare industry bears little resemblance to the regulatory environment that existed even a decade ago. New reimbursement methodologies, expanding reporting obligations, technological advances, and increased enforcement initiatives have significantly raised compliance expectations across virtually every area of medical practice. Healthcare providers today must balance clinical responsibilities with extensive documentation requirements, evolving medical billing and coding standards, privacy obligations, and quality reporting initiatives. Simultaneously, federal and state agencies continue refining enforcement strategies designed to identify potential fraud, waste, and abuse within publicly funded healthcare programs. The result is a regulatory landscape where mistakes do not necessarily arise from intentional misconduct. Documentation inconsistencies, billing interpretation differences, coding errors, or administrative oversights may trigger healthcare audits or compliance reviews that require substantial time and resources to resolve. Healthcare fraud investigations likewise have become increasingly data-driven. Government agencies frequently analyze billing patterns, utilization trends, and claims data before initiating inquiries. Sophisticated analytical tools enable investigators to identify statistical anomalies that may warrant additional examination, even before any allegation of wrongdoing has been formally established. Private insurance companies have adopted similar approaches. Payors routinely conduct reimbursement reviews, overpayment analyses, and utilization audits designed to identify claims requiring further examination. These reviews often create operational challenges for providers who must simultaneously continue delivering patient care while responding to documentation requests and administrative inquiries. As regulatory compliance expectations expand, physicians and healthcare organizations increasingly recognize that maintaining effective compliance programs is not merely an administrative obligation but an essential component of long-term operational stability. The most common legal risks facing healthcare providers. Legal risk in healthcare rarely originates from a single source. Instead, providers often face overlapping regulatory responsibilities involving multiple agencies, insurers, and licensing authorities. Among the most common areas of concern are medical billing and coding issues. Coding systems continue evolving alongside changing reimbursement rules, making accurate claim submission increasingly complex. Small documentation deficiencies or inconsistent coding practices can create significant financial consequences during payer reviews or government audits. Reimbursement disputes also remain a frequent source of legal challenges. Providers may disagree with insurance companies regarding coverage determinations, payment calculations, or alleged overpayments. Resolving these disagreements often requires careful analysis of contractual obligations, applicable regulations, and supporting medical documentation. Healthcare fraud investigations represent another area where providers benefit from experienced legal counsel. Investigations conducted by government agencies frequently begin long before formal allegations are made. Responding appropriately during the earliest stages can significantly influence how matters develop. False Claims Act concerns present additional complexity because liability may arise from allegations involving inaccurate claims submitted to government healthcare programs. These matters often involve detailed examinations of documentation practices, billing methodologies, internal compliance procedures, and operational controls. Healthcare compliance reviews similarly extend beyond financial issues. Regulators may evaluate organizational policies, internal reporting structures, training programs, documentation protocols, and quality assurance procedures when assessing whether providers have established effective compliance frameworks. Documentation remains central to nearly every regulatory inquiry. Clinical decisions may be entirely appropriate from a medical perspective, yet incomplete or inconsistent records can complicate efforts to demonstrate compliance with applicable requirements. These examples illustrate why healthcare litigation often extends beyond courtroom proceedings. Many disputes develop through administrative processes, regulatory reviews, or investigative stages that require thoughtful legal strategy before formal litigation ever occurs. The value of proactive legal strategy. Healthcare law is often most effective when it prevents disputes instead of simply responding to them. Experienced healthcare defense attorneys play an important role in helping providers identify areas of potential exposure before they evolve into significant legal challenges. By evaluating compliance programs, reviewing documentation practices, and advising organizations on regulatory developments, legal counsel can strengthen institutional preparedness while reducing unnecessary risk. Preparation also positions healthcare organizations to respond more effectively when audits or investigations occur. Providers that maintain organized documentation, consistent compliance procedures, and clearly defined internal processes often navigate regulatory inquiries with greater confidence than organizations attempting to reconstruct records after concerns have already emerged. Robyn Lynn Sztyndor has built her healthcare law practice around this strategic perspective. Her experience includes defending physicians and healthcare providers in matters involving healthcare fraud investigations, medical malpractice defense, reimbursement disputes, billing and coding issues, and complex healthcare litigation. She has also served as healthcare counsel on significant healthcare fraud matters involving claim data analytics, healthcare compliance, and billing practices while working alongside nationally recognized legal teams. Her approach reflects the belief that prevention frequently provides greater value than reaction. Developing sound legal strategy before enforcement actions arise allows organizations to strengthen internal controls, improve regulatory compliance, and make informed operational decisions with a clearer understanding of potential legal implications. Preparation also protects professional reputations. Healthcare providers devote years to building trust within their communities. Addressing compliance concerns proactively helps preserve that trust while minimizing operational disruption during periods of regulatory review. Helping healthcare providers focus on patient care. Every hour devoted to responding to audits, investigations, or reimbursement disputes is time diverted from patient care and organizational leadership. For physicians and healthcare executives, legal uncertainty can create significant distractions that affect staffing decisions, operational planning, and financial forecasting. Even when providers ultimately demonstrate compliance, prolonged regulatory inquiries may consume considerable administrative resources. Strong legal preparation helps reduce that uncertainty. Effective healthcare risk management creates organizational confidence by establishing clear policies, consistent documentation standards, and thoughtful communication practices. Leadership teams can devote greater attention to clinical excellence and organizational growth when compliance systems are functioning effectively. Communication also remains essential throughout this process. Healthcare organizations benefit from legal advisors who understand not only regulatory requirements but also the operational realities facing physicians, administrators, and practice managers. Long-term legal partnerships support this objective by providing ongoing guidance rather than crisis-driven representation alone. Regular compliance assessments, educational initiatives, policy development, and strategic planning contribute to stronger organizational resilience while helping providers adapt to changing healthcare regulations. Ultimately, proactive legal guidance enables healthcare organizations to focus on what matters most, delivering safe, effective, and compassionate patient care within an increasingly complex regulatory environment. Why experience matters in healthcare defense. Healthcare law demands both legal knowledge and practical understanding of how modern healthcare systems operate. Over more than 15 years practicing healthcare law, Robyn Lynn Sztyndor has concentrated her work on defending healthcare providers facing complex legal and regulatory challenges. Her experience includes medical malpractice defense, healthcare fraud litigation, physician defense, reimbursement disputes, billing and coding matters, and Department of Justice investigations. She has also provided expert guidance on healthcare compliance issues involving claim data analytics, billing methodologies, and regulatory requirements. Beyond private practice, she serves as the full-time compliance officer for a major multi-specialty healthcare organization, overseeing compliance and audit functions while working closely with operational leadership. This combination of litigation experience and day-to-day compliance leadership provides practical insight into the challenges healthcare organizations encounter as regulations continue evolving. Her multi-state licensure further contributes to a broader perspective on healthcare regulation. Practicing across multiple jurisdictions requires adaptability and an understanding that legal strategy must often account for differing procedural frameworks while remaining grounded in consistent compliance principles. Throughout her career, Sztyndor has emphasized strategic legal advocacy designed to help clients navigate complicated legal environments with careful preparation, clear communication, and informed decision-making. That philosophy recognizes that successful healthcare defense extends beyond courtroom advocacy. It includes anticipating regulatory developments, strengthening compliance programs, and helping organizations make sound decisions before problems escalate. As healthcare regulations continue becoming more sophisticated, providers increasingly benefit from legal advisors who understand both enforcement priorities and the operational realities of modern medical practice. Healthcare will almost certainly remain one of the nation's most closely regulated industries. New reimbursement models, expanding oversight initiatives, and evolving compliance expectations will continue shaping how physicians and healthcare organizations deliver care while managing legal responsibilities. Navigating this environment requires more than familiarity with statutes and regulations. It requires preparation, strategic thinking, and experienced guidance capable of helping providers manage risk while supporting long-term organizational success. Attorney Sztyndor represents that proactive approach to healthcare defense by emphasizing thoughtful legal strategy, strong healthcare compliance, and practical risk management that allows physicians and healthcare organizations to move forward with greater confidence in an increasingly complex legal landscape.